The opiate epidemic really came out of treating people for chronic pain. The medical field was looking for ways to helping people manage chronic pain from injuries. We recognize and help validate that they do have chronic pain. Once people hear that and they are able to be heard and listened to, then we can help them find better ways to manage it. If you only address the addiction piece, you're going to set someone up to go back out and then relapse quickly because their pain has not been addressed. One of the things we do is help them find different ways to move physically. Nutrition, medications, and our pain group, which is a group that we've built around mindfulness, stress reduction, strategies, and coping skills that help people find different ways to manage their pain.
It's interesting here at Lakeview when we stop the opioids, how the brain resets. And they'll say, wow, I have pain, but I thought it was a 10, but it's really a 3 or 4. And guess what? Those non-opioid medications and treatments that you're offering are actually helping me now. We're getting away from opioids as being our only tool in our toolkit. The old saying, if all you got is a hammer, everything looks like a nail. We've got to get away from that. So at Lakeview, we want multiple tools in our toolbox so that we can offer the most to our patients.
Oftentimes when our patients first come in, they're not focused on their relationship with food. So one of my roles here is to work with patients and actually shift their perspective a little bit so that they can see how their relationship with food may have been contributing to their addictive behaviors. The solution really is trying to take folks' attention away from dieting and more towards developing regular eating habits that are nutritionally sound. As a facility, there's been a shift towards a diet that includes more components that decrease inflammation. If we have more foods in our diets that are associated with decreased inflammation, that's going to lead to a lower experience of pain.
Helping people find function with their chronic pain is really important to us. And that's why we've invested so much into our wellness center, because we want people to have a lot of different opportunities to be functional and active, whether it be yoga, whether it be using the pool, whether it be using a traditional gym machine. They get a full physical therapy evaluation and they get a personal trainer. And that gives them a whole new level of quality of life.
I have been in recovery myself for 8 years. There's this professional and personal combination that just makes it amazing to be able to really feel like I'm working in my purpose, helping folks foster a positive relationship with themselves, helping to drop some of the maybe shame, stigma, guilt that they might be feeling around food and around their relationship with their body.
There are very few programs in the country that are doing this kind of wraparound care where they bring someone in, get them off their pain meds, but we also help them find a different quality of life. The way that we approach it, I feel, gives people a real leg up with their sobriety. Chronic pain is going to be less of a trigger for relapse when they leave us.